The study that I chose to present on is trans-theoretical model-based exercise counseling combined with music, skipping, rope exercise on childhood obesity. The trans-theoretical model and stages of change is the model that the study was based off of. This model explains change as a process that unfolds over time, progressing through a series of 6 stages, but not always in a linear manner. The understanding about why some people fail to change or require multiple attempts to change came through the stages and phases of change. These stages are pre-contemplation, contemplation, preparation, action, maintenance, and termination. So talking a little bit more about the 6 stages of change, I'll go through them. Pre-contemplation is the stage in which people do not intend to take action in the near term. Here they avoid reading, talking about, or thinking about their behavior. People may be in this stage because they aren't informed enough about the consequences, or they have previously tried to change or discouraged. Contemplation is the second phase, or second stage, where they intend to change behaviors in the next 6 months. People in this stage are aware of the pros and cons of their behavior. This balance can keep someone stuck in this stage of contemplation, and this is also called behavioral procrastination. The third is preparation, where people intend to take action soon, usually within the next month. Typically, they have taken some steps already and have a plan of action. And the fourth is action. People have made specific overt modifications to their lifestyles within the past 6 months. Typically, not all modifications of behavior count as action. Usually, people have to attain a criteria, such as getting a cancer screening to reduce their risk for cancer. The fifth is maintenance, where they have made specific overt modifications in their lifestyles. They are working to prevent relapse, and they are increasingly more confident that they can continue their changes. Based on self-efficacy data, maintenance can last from 6 months to 5 years. And then lastly is termination, where people report having 0 temptation and 100% self-efficacy. The processes of change are 10 processes that people go through to progress through the 6 stages of change. Conscious raising is increasing awareness about the causes, consequences, and cures, more so like education. Dramatic relief is increasing negative or positive emotions to motivate taking appropriate actions. Self-reevaluation is cognitive and reassessment of one's self-image. Environmental reevaluation is assessment of how one's behavior affects one's social environment. Self-liberation is belief that one can change and the commitment and recommitment to act on that belief. Helping relationships are caring, trust, openness, and acceptance, as well as support from others. Social liberation is increase in healthy social opportunities. Counter-conditioning is learning healthier behaviors that can substitute for problematic behaviors, and stimulus control is removing cues of unhealthy habits and adding healthier prompts. Reinforcement management is rewarding oneself or being rewarded by others for making progress. Other components in the trans-theoretical model is decisional balance and self-efficacy. Decisional balance is composed of pros and cons of change that weigh into the individual choice of behavior change. Self-efficacy consists of confidence and temptation. Confidence is the person's confidence in changing or maintaining a specific behavior, especially in high-risk situations. And temptation is just the converse of self-efficacy, where they have a strong urge or temptation to engage in unhealthy behavior. So in this specific study that I chose, the behavior is physical activity and the health issue is childhood obesity. So childhood obesity is a serious public health problem and has increased twofold in the last decade in Korea. Obese school-aged children are vulnerable to health problems such as high blood pressure, high cholesterol, impaired glucose tolerance, asthma, joint problems, and also psychological problems such as low self-esteem. Obese children are more likely to become obese adults, including more serious health problems such as cardiovascular disease, diabetes, and cancer. And some contributing factors include genetics, unhealthy diets, physical inactivity, and their environments that can influence it. So the aims and purpose of this study is to examine the effects of 8 sessions of TTM, which is Trans-Theoretical Model-based tailored exercise counseling, also offered with music, skipping rope exercise classes, in modifying stages of change, decisional balance, self-efficacy, and BMI, and whether it would improve glucose tolerance and lipid profile of overweight and obese school children. Next, going into the methods, this was an experimental study with non-equivalent pre-test and post-test. There were 75 participants, 48 in the experimental and 27 in the control group. Overweight and obese children were recruited from a convenient sample of 4 elementary schools in the same metropolitan area in South Korea. Cluster randomization was used where schools were randomly assigned to experimental group and control group. There were 2 schools for each group. The children were identified overweight or obese based on health screening results. Teachers also sent letters to parents for consent. Criteria included BMI for age was 85% or greater. Primary language was Korean. They were in 3rd grade or higher in the elementary school, and they also couldn't have any chronic health problems. To measure BMI, they used age and gender. For physiological examinations, they calculated fasting blood sugar, total cholesterol, triglycerides, and high and low density lipoprotein cholesterol through blood withdrawn. Self-report questionnaires were also used. So the methods that they used in this study to classify the participants in the stages of change were that they used one question aimed to classify the participants in one out of the 6 categories of stages of change. Students were asked to select the response category that most accurately described their current exercise behavior or intention for exercise. An example question was, I am not performing regular exercise currently and will not start exercise within the next 6 months. And this classified the participant in pre-contemplation stage. And those who performed any type of exercise for more than 30 minutes per session for 3 days or more per week was considered regular physical activity, not including physical education classes at school. Methods used to determine decisional balance. There were 14 items that were used to measure. They used a 5-point Likert scale to measure pros and cons of exercise. 1 was strongly agree and 5 was strongly disagree. An example question for pro and con are regular exercise will increase my energy and interest in school. And for con, it is difficult to find time for exercise. Higher scores indicated perception of more benefits, which is pros, and barriers, cons to exercise. Next, the methods that were used to determine self-efficacy among the participants were 5 questions. Children were asked whether they have confidence in performing regular exercise in various negative situations, such as negative emotions and bad weather. An example question is, I am confident that I could continue to exercise in bad weather, such as snow or rain. They also used a 5-point Likert scale, which was 1 was strongly agreed and 5 was strongly disagree. Details about the interventions that were provided in this study. The experimental groups were given counseling based on the TTM model. They received 8 sessions during a 3-month period, 4 consecutive weeks for the first month and every other week for the second 2 months. 8 individual counseling sessions were given by trained nurses, and each of those was tailored based on the stage of change of each participant. And then to build self-efficacy, students were encouraged to establish short-term incremental goals in each counseling session. Participants were also given TTM-based counseling booklets. The experimental group was given the booklets along with counseling for each of these topics, and the control group was given the booklets with only 1 week of counseling. Each of the weekly content was related to the processes of change, just to help them move through the stages to get to action. The contents included causes and problems of overweight, obesity, and benefits of exercise related to consciousness raising and pros of changing process. Self-image assessment as physically active or inactive person was self-evaluation process. Identify problem, health behaviors and resulting problems, dramatic relief process. Strategies overcoming barriers to exercise, cons of changing, commitment to changing using a written pledge, and evaluating exercise plans related to self-liberation process. Parental involvement strategies in giving assignments to perform exercise with parents, helping relationships, discussion of efforts to overcome barriers, cons of changing, and lastly, self-reflection of past effort to promote exercise and feedback from interveners, reinforcement management process. And in order to come up with all of this information, they held a focus group, which was a needs assessment, and this included parents and children in that community, and asked them questions that were important for the needs of the program, and that's how they come up with all of these topics and specific information within. Participants in the control group were provided counseling booklets and one session of counseling, which was identical to week 1 in the intervention group. They also got a weekly 60-minute session of music skipping rope, which was provided to the control group and the experimental group for the 3 months, and that included 12 sessions. And then there was a post-test for both groups at 6 months from the baseline testing. For the music skipping rope sessions, children gathered after school on Wednesdays to participate, and parents got a reminder call or text the day before to increase participation among the students. And then at the end, participants received certificates for completion of the counseling program. And then the experimental group specifically got booster telephone counseling provided to the children for 3 months after the intervention. Moving on to the results. As far as changes in physiological variables and BMI after the intervention, fasting blood sugar increased significantly after 6 months for both experimental and control groups. And as I'll mention later, this could be related to the seasons in which they tested pre-test and post-test. The other physiological variables did not change at the post-test. BMI increased significantly in the participants in the control group, but did not change, so it maintained and stayed steady in the participants in the experimental group. As far as changes in psychosocial variables after intervention, self-efficacy significantly increased among the children in the experimental group, and the results from the control group for self-efficacy were not significant. As far as pros and cons of exercise, they did not change for either group at the post-test. And stages of change, 36.2% of the experimental group compared to 17.4% of the control group had advances in their stages of change related to exercise, and that was by at least one stage that they advanced. Some discussion points that were presented in the study include the results of the study indicate that combined approach of TTM-based exercise counseling and exercise sessions combined was more beneficial to overweight and obese school-age children than just the exercise alone. Development of the theory-based intervention to include information from the needs assessment of the children and parents increased the intervention effectiveness, and this is referring to the needs assessment that they conducted prior to making the booklets. Next, positive effects at 6 months after the intervention in our study may indicate that this intervention has potential to produce long-term health benefits among overweight and obese children. Self-efficacy can have long-term effects on improving exercise participation. And lastly, BMI change was partially successful. Although there were no significant changes among the experimental group, there were changes in the control group, which showed significant increase after 6 months. So while they would have liked to see a decrease in the experimental group, it was partially successful in that their BMI did not increase like the control group did. Some areas of the study that can be translated to health, education, and behavior are theory provides explanation behind behavior, specifically physical activity in this study. Theory-based interventions help to overcome barrier and implement change in health behaviors. In past studies on the trans-theoretical model and short-term interventions helped shape this intervention and ones in the future. So this is referring to research to practice setting. And by categorizing people into stages of change through TTM concepts, we can advance their readiness to change, getting them closer to the intended behavior change. And an example of theory-based interventions in school settings is from this study, and the study showed hands-on learning for the children through theory-based counseling, which it refers to practice. Some specific points that were touched on for the conclusions are as follows. This study partially supports the trans-theoretical model-based exercise intervention and that it found that combined theory-based counseling and exercise classes was effective in improving self-efficacy and maintain long-term BMI measures. Future studies are needed to verify longer-term effects past 24 months of weight management interventions. And due to the post-test being in December, BMI could have been stagnant due to the seasonal changes. Those in the earlier stages of change may take longer to progress to action stages, while taking even longer to demonstrate weight loss, which explains some of the BMI scores. And fasting blood glucose levels significantly increase for both groups, and FBG levels are higher in the winter months and lower in the spring, which could explain the study of the results. In addition to limitations that the study brings up, I also listed some that I came up with. Seasonal changes between pre-test and post-test may have affected physiological biomarkers. The study did not control for confounding variables that may have affected the intervention outcomes, such as school environment or family characteristics, and even family support. The content of the questionnaires had to be translated into Korean for the students, and the findings relied on self-report. Due to the fact that each counseling session was tailored to each student, which it should have been for the phases of change, it could have led to differences among them, however. And BMI is not always accurate and predictor of obesity, and the participants were children, so they may have been a little bit unclear of their actions and their answers. And then also it could have taken longer period of times for earlier stages than later stages for participants to make their way through to get to action. The talking points that I wanted to ask the class include: the study showed that the students' decisional balance, which is the pros and cons, did not significantly change from pre and post test. Do you think changes in decisional balance, meaning more pros and less cons, would have made a difference in their success in intending to increase physical activity and decrease BMI? Why or why not? And second, in your opinion, what are some disadvantages to using the trans-theoretical model in this intervention to promote life-lasting behavior changes in children? And lastly, I included the references, which shows the book and also the study here on this last slide. And thank you for listening.